Welcome back to our discussion on the flagellates. So far, we've covered 4 intestinal flagellates and 1 urogenital flagellate. The next chapter involves blood and tissue flagellates, also known as the hemoflagellates. In this category, we have the genus Leishmania with several species, and the genus Trypanosoma with several species under that. So first we will cover the Leishmania group. However, as a generalization, all the hemoflagellates are transmitted by an insect vector, an arthropod, unlike the other flagellates we've talked about that did not apply. But for all your hemoflagellates, there's some sort of insect vector. We have 4 new terms to cover. There's new life cycle stages for these hemoflagellates. We have the amastigote, the promastigote, the epimastigote, and the trypomastigote. Now, not all of these are found in each hemoflagellate, but these are just new terms I'm introducing. The promastigote and the epimastigote are only found in the insects. So for diagnostic purposes of man, we just need to learn how to identify the amastigote and the trypomastigote. The promastigote is the form that has a flagella. But we will not see that, like I said, in the human specimens. Starting with Leishmania, we will cover Leishmania tropica, Braziliensis, Mexicana, and Donovani. You'll notice the word complex behind each one of these. That's because there's at least 20 species that are involved that are clinically significant with the genus Leishmania. And they've been grouped together by the symptoms they cause. But we're just lumping them together, and we're just going to refer to them by the species listed here: Tropica, Braziliensis, Mexicana, and Donovani. And remember, I'm abbreviating the genus here, but every time you write it out on a quiz or a test, you need to write out the genus. So talking through the life cycle stages for Leishmania, we will start at the top, number 1, where we have a sandfly takes a blood meal and injects the promastigote stage into the skin. Okay, the sandfly is our vector for Leishmania. It is a blood-sucking fly, and specifically it's only the females that do this. So the sandfly is already infected with the parasite, and when it lands on a human, it's sucking our blood, but at the same time, there's a parasite in its salivary glands. That life cycle stage for Leishmania is the promastigote. So when it takes its blood meal, at the same time, it's injecting the promastigote stage into our skin. Remember I said this is the form that has a flagella, and this is the infective stage. This is how man gets infected. So inside of our blood vessels, that's able to travel with the flagella, and it gets phagocytized by macrophages. Inside of macrophages, the promastigote form transforms into amastigotes. This is the diagnostic stage, is seeing amastigotes inside tissue or other macrophages, any sort of histiocyte. So then, to continue the life cycle, another sandfly needs to come along. It's going to land on our skin and take a blood meal, and while it does that, it's going to ingest those macrophages infected with amastigotes. So that is the infective stage for the sandfly, is to ingest macrophages containing amastigotes. Inside of the sandfly, the amastigote is going to transform into the promastigote inside its gut, and those promastigote forms will migrate to the salivary glands, and then it can infect another human. This is a nice up close and personal picture of the sandfly. So let's talk through it again. The female fly ingests which stage? Which stage is infective for the fly? Remember, it's the amastigote, when the insect takes a blood meal from an infected human. The amastigote will develop into the promastigote in its gut and migrates to the salivary glands. And this is how it's easily transmitted to another human when it goes and lands on someone else and takes a blood meal. So the promastigote gets inside another human. It's phagocytized by a macrophage. Inside the macrophage, it develops into the amastigote. And the amastigote is what's diagnostic. Now we will talk through the 3 major clinical manifestations of leishmania. There's cutaneous leishmaniasis, mucocutaneous leishmaniasis, and visceral leishmaniasis. Cutaneous leishmaniasis is caused by 2 of our species, Leishmania tropica and Leishmania mexicana. The common name for being infected with Leishmania tropica is oriental sore, and being infected with Leishmania mexicana is also known as New World leishmaniasis. And these are just named because of their geographical distribution. Cutaneous leishmaniasis is usually a self-limiting infection where the sandfly landed and took its blood meal and injected the parasite into us. It looks like a pussy and gets crusty circular lesion, usually on extremities or the face. It's where the insect easily landed on the body and bit us. So the bite will cause intense itching, and this is where the patient becomes susceptible to secondary bacterial infection because the skin becomes so raw and exposed. The lesion may or may not be painful, and it will eventually scab over. So this looks like it's part of a hand or leg. This is on her face, and also the ears are a common site for the insect bite. Getting a little bit more serious is mucocutaneous leishmaniasis. This is caused by Leishmania brasiliensis. Its common name is Espundia. The lesions are similar to cutaneous leishmaniasis, but we're getting mucosal involvement, so usually nose, mouth, the lips are involved, and an ulcer develops in which cartilage gets destroyed, causing permanent disfigurement. So you can see this gentleman's nose and even the top of his mouth might start to be infected. Again, permanent disfigurement can result, and this is also susceptible to bacterial infection. The most serious out of all of these would be visceral leishmaniasis, caused by Leishmania donovani. Common names for this one are Kala azar, dum-dum fever, or black disease or black fever because of a characteristic darkening of the skin. You've got your most common geographical distribution, but also I want to add India, Bangladesh, Sudan, and Brazil. As its name implies, visceral, we have organ involvement with this one. So liver, lymph nodes, spleen, bone marrow, major organs, heart and kidneys can be affected. Symptoms would reflect where it's affected, but in general, usually people always have severe hepatosplenomegaly. And in fact, the spleen can enlarge so much it gets bigger than the liver. So they exhibit severe abdominal swelling, general malaise, anorexia, headache, fever, chills. The symptoms may even mimic malaria. The mortality rate is pretty high in untreated cases. A chronic case could result in death within 2 years. An acute case could result in death within weeks. Again, the diagnostic stage is the amastogote found in a macrophage or any histiocyte. So here you have a histiocyte, and it's chock full of the little parasites, and they are very small. That amastogote is about 3 to 5 micrometers in size. But if you were to zoom in, you would notice it's oval with pale blue cytoplasm, a large red or purple staining nucleus, and a rod-like kinetoplast, which is a DNA structure. But just in general, if I were to show you a picture like this and it says, it's obviously a cell, I tell you it's a tissue cell or it looks like a macrophage, and you can see a whole bunch of polka dots inside of there, those are amastogotes inside of a tissue cell. The type of specimen we need depends on each species. So remember, Tropica brasiliensis and Mexicana involve skin lesions. So we would want a skin scraping for those to diagnose those species. For Donovani, we would need a more invasive type specimen, so a biopsy of the affected organ.